Opioid use and chiropractic care. Given the current opioid crisis, questions continue to arise regarding the value of alternatives that are non-pharmacologic and the actual effectiveness of opioids in comparison. In fact, the Joint Commission, the accrediting body for hospitals, just required a new standard for hospitals to provide patients non-pharmacological options for their pain. Timely, then, is a new study comparing the use of opioids by patients who see chiropractors versus those that do not. It's titled Association Between Utilization of Chiropractic Services for Treatment of Low Back Pain and Use of Prescription Opioids, published in the Journal of Alternative and Complementary Medicine in 2018. Some surprising stats. More than 650,000 opioid prescriptions are dispensed per day in the United States. Although it may seem intuitive that this is primarily by specialists such as surgeons post-hospitalization, primary care physicians account for nearly 50% of those opioid prescriptions. Particularly relevant to us as chiropractors, among U.S. adults prescribed opioids, 59% reported having back pain. And did you know your chance of being a chronic abuser of opioids increases to 13.5% by 8 days of use and basically 30% by 31 days of use? Prescription opioid-related deaths tripled from 1999 to 2010. In 2015, there were over 22,000 deaths involving prescription opioids. This is an increase of 19,000 deaths over the previous year, while sales of prescription opioids in the United States nearly quadrupled from 1999 to 2014. So although these statistics are heart-wrenching, is there really any evidence that chiropractors are part of the solution? A retrospective claims study of over 165,000 adults published in 2007 found that patients treated by chiropractors had a reduced use of opioids with related decrease in their cost of care. It was titled Narcotic Drug Use Among Patients with Lower Back Pain in Employer Health Plans, a retrospective analysis of risk factors and healthcare services. And more recently, in 2016, another study published in JMPT also showed a decreased use of opioids based on per capita number of chiropractors. It was entitled Cross-Sectional Analysis of Per Capita Supply of Doctors of Chiropractic and Opioid Use in Younger Medicare Beneficiaries. Our current study for review is a retrospective study conducted in New Hampshire. So why New Hampshire? First of all, the health data was available, and in 2015, New Hampshire had the second highest age-adjusted rate of drug overdose deaths in the United States, a 31% increase from the previous year and more than double the national rate. So who was the study population? It was comprised of New Hampshire residents aged 18 to 99 years who were enrolled in a health plan in 2013 and 2014 and with at least 2 clinical office visits within 90 days for a primary diagnosis of low back pain in 2013, comprised 13,384 subjects. The researchers compared 2 cohorts, recipients and non-recipients. Recipients of services provided by doctors of chiropractic were defined as subjects with at least 2 office visits for a primary diagnosis of low back pain. Non-recipients were defined as subjects who received no services provided by a doctor of chiropractic. The results are unequivocal. 19% of 6,868 recipients of chiropractic care filled a prescription for an opioid, compared with 35% of 6,516 non-recipients of chiropractic care. The adjusted likelihood of filling a prescription for an opioid in 2014 was 55% lower among recipients compared with non-recipients, with an odds ratio of 0.45 and a p-value of 0.0001. And regarding costs of care, in 2013 among recipients compared with non-recipients, annual charges per person for filling opioid prescriptions were 74% lower, and charges were 78% lower for clinical services. And in 2014, among recipients compared with non-recipients, Annual charges per person were 78% lower for opioid prescriptions and 71% lower for clinical services. As remarkable as the findings are, like all studies, there are always weaknesses and some potential biases. In a recent national poll, 78% of U.S. adults indicated a preference for alternatives to prescription pain medication, but adults who had never seen a chiropractor were among those most likely to prefer pharmacologic pain treatments. So in other words, patients' choice may have played a role in who would choose chiropractic versus pharmacologic care. Yet coupling these findings with other recent studies appears to point in the direction of at least a trial of chiropractic management first. And what we might assume about opioids, given their apparent strength of effect, may not in the long run hold true. Shockingly counterintuitive were the findings in this March 2018 publication in the Journal of the American Medical Association entitled Effect of Opioid versus Non-Opioid Medications on Pain-Related Function in Patients with Chronic Back Pain or Hip or Knee Osteoarthritis Pain, the SPACE Randomized Clinical Trial. The authors conclude, quote, treatment with opioids was not superior to treatment with non-opioid medications for improving pain-related function over 12 months. Results do not support initiation of opioid therapy for moderate to severe chronic back pain or hip or knee osteoarthritis pain, unquote. If we couple that with a recent systematic review regarding manipulation in chronic low back pain, we see a supportable argument for initial chiropractic management that includes manipulation. Published in the Spine Journal in 2018 is Manipulation and Mobilization for Treating Chronic Low Back Pain, a Systematic Review and Meta-Analysis. Comparing manipulation and mobilization to other alternatives for chronic low back pain, including exercise and massage, the researchers found that there was a small to moderate effect in favor of manipulation for patients with chronic low back pain with pain duration of at least 3 months or more, but not for mobilization. The effects seemed to increase to a strong moderate effect over the next 3 to 6 months follow-up for reducing pain compared with other active comparators. Manipulation was also shown to reduce disability, demonstrating a large effect size. So perhaps this is that evidence-based moment of critical mass where, taken together the lack of support for use of opioids for chronic low back pain, the mounting evidence that chiropractic care that includes manipulation is effective, and the emerging evidence that chiropractic care can save healthcare dollars, our opportunity is at hand to demonstrate our value as a substitute for pharmacological management of chronic low back pain. The dire need for an alternative to the crisis of opioid overuse and death warrants more studies and hopefully more inclusion of chiropractic services.